5 months ago, I met Marcus and his mother looking helpless at the Kenyatta National Hospital. Battling a rare skin condition, Marcus was unable to stand, sit, talk, or even play. His mother was on the verge of giving up. The hospital staff, though concerned, could not do much but alleviate his pain. This is Marcus now. For just a little over 5 months, he has been at the Kimbilio Hospice. Seeing her son walk, read, sit, and even eat by himself has put a smile back on Jacqueline's face. It has not been an easy journey, but he's getting there slowly. Thanks to the dedicated staff at the Kimbilio Hospice who have offered him and other patients intensive palliative care. Amen, hallelujah. In Kenya, palliative care is not a new way of offering health service to patients suffering from chronic diseases. But sadly, the country has paid little attention to patients requiring palliative care. In many parts of the country, before and after devolution, palliative care has hardly been mentioned. Once a patient has stopped receiving active medical treatment, doctors usually send them home because nothing else can be done. Families that have not been prepared to handle such patients end up abandoning their relatives. In the end, patients die a very painful, miserable death.
And we had a very robust discussion about palliative care. Of course, you can see the fact that it's been a new phenomenon. It's one that's totally unknown, so we have to go past the first rope, which is getting to understand what palliative care and how big the need is.
Margaret Mburu is from Kiambu. She first discovered that she has cancer in 1993. Thankfully, with radiotherapy and chemotherapy sessions, she was able to fight the disease. 20 years later, the breast cancer recurred.
Hiyo kujua what is cancer, inakujaje. By then, wakati nilikuja hapa siku anasema naweza pata recurrence, lakini tulifundishwa unaweza pata recurrence.
Her first battle with cancer was at the age of 40. She is now 68. She tells me her life has been prolonged because of the palliative services she receives.
Tulikuwa tunakuja once a month. Na hiyo once a month unakuta they are new patients. Na hao wako chini wamejua ati cancer ni kifo. Sasa mnawekana nguvu.
Jen Timayo from Kajiado has been bringing her husband for palliative care for several years now. Her husband Timayo was diagnosed with paranasal cancer.
Luckily, I found the doctor who works under them, an oncologist, Dr. Vijay. That time, I was healthy, not the way I am now, although I'm better. He looked at me and told me, "What's wrong with you? You must be very stupid." Unfortunately, cancer, I think, is a spirit. It's something funny. It's devilish. I had been deaf, blinded. I could not research what was written in the report. So I did not know, and I kept carrying it with the X-ray. He looked at it and told me, "What's wrong with you? This is cancer. This is serious. It's going to the brain. It's a pharynx, nasal, and stage 4. By the time they had done it to stage 4B.
At stage 4, cancer will usually put any patient on their deathbed. But thanks to palliative care, Timayo is still breathing, walking, eating, and talking.
Faraja is not just an institution. To me, it's the angel of God. It's the hand of God. When I used to think I have friends. I have friends all over. When I used to work, Kisumu, Mombasa, everywhere. And I thought I was known. But when trouble came, I discovered there's nobody for me. Unfortunately and sad enough, even relatives, my own relatives, blood relatives.
If you do not support your colleague, your brother, your mother, your father, while they are sick, ask yourself, if it is me who is in this bed, who is in this seat, how would I feel if nobody is coming to visit, support me, and just be with me?
Doesn't choose, so anyone can get it.
Mary Achieng comes from one of the sprawling slums in the county of Nairobi. She had back pains and abdominal pains that would never go away. Mary's cervical cancer was discovered when it was at stage 1.
For my chemos, I had to do them, like I had to be admitted so that I can go for the sessions. So I saw some of them. they are really traumatizing because you are here, you are stage 1B. Here there is stage 3. Here there is stage 4. And then you come for the next visit, the stage 4 has died. Amekufa ameenda. Now you are remaining with another person here. And then there is another one walks in fresh, stage 0. So that, I think, for me, that part is the most traumatizing. Because you see like it's death. This is the journey. You move from this stage to the, it's like you are graduating, yeah?
In order to survive the disease, doctors opted to remove her uterus. She's now receiving palliative care because at the age of 20, she could easily be depressed or suffer mental health illness.
After that, now I have to be put on monitoring clinics, follow-up clinics, and then do the hormone therapy because the uterus was removed. Now you have to take supplement of some hormone drugs so that you can at least, the body can respond normally.
Cancers have their own kind of chemotherapy, they have their own treatment.
Cindy is one of the managers at the Faraja Cancer Center. She takes me around the facility where I meet a group of medical personnel who have dedicated their lives to helping those who are critically ill. It is a job she cherishes every day. There are patients who are referred here when they are extremely weak, sometimes near death.
If you have side effects to your chemotherapy, instead of going home and suffering from depression, which lowers your immune system further, come and have a nutrition session with a qualified nutritionist who will tell you what to eat, what not to eat. They walk the journey with you. If you are depressed because you've been abandoned, Nimrod, it happens, you're married, you have your breast removed, or you have cervical cancer, and you know it's affecting your marriage, whatever the case might be, and you've been abandoned. Come, let's talk. And then not only are you talking with a counselor, let's also put you in support groups so you can talk to people who have walked the journey with you so that it does not look like you're mutually exclusive.
Thank you. We keep trying. Dr. Caroline Karugu is the patron of the Kenya Hospice and Palliative Care Association. She says palliative care has for long been treated as a service for people whose time on earth has come to an end, a mentality that has to change immediately.
I want to place that burden squarely on governors because it really depends on the governor being the leader of the county government. I think the first quick win would be to embrace these palliative care centers, these hospices. Let them walk into these places, understand what those hospices are doing because they are serving their people, and understand areas where they can partner.
First Lady Margaret Kenyatta yesterday launched Kenya's policy on palliative care in the country, which will ensure that palliative care is given prominence just as the other health services. Nimrod Tabu, Citizen TV.
Tupige makofi tafadhali.